Now let's go talk about the meninges and dural venous sinuses. So once the CSF is made within the brain, it's going to get reabsorbed by one of the meningeal layers, and then the layers within the meninges actually will form venous sinuses as the CSF gets returned back to the blood. So let's first start talking about the different meninges. The pia mater is on the physical surface of the brain itself. It actually is more like a layer of Vaseline, if you will, on the surface of the brain. So it's not really a layer that you're going to physically be able to pick up. However, we can see on this brain here where some of this sort of whitish, I like to say it looks like a wet Kleenex, that layer, this sort of bunched up here, but that is the arachnoid mater, and that's going to be pretty important. It's within the arachnoid mater, and these little dots within it is actually what's returning cerebral spinal fluid into the blood. Here we see a sagittal view. We have the cerebral spinal fluid in blue. We can see a zoomed in view here. This would be like, say, confirming this forehead region. We can see the bone, the dura mater adhered to the bone on the backside. And then we have the arachnoid, this spider web-like structure. That's where the fluid is actually running through. And then these little bumps or granules within that arachnoid mater is what's going to reabsorb cerebral spinal fluid. We can see here on the dura mater is a very tough, very thick layer, if you will, and it's in the brain that's actually two layers. There is a periosteal layer that's going to line the inside, actually physically adhered to the skull, and then there's a meningeal layer. And the meningeal layer will actually make folds down in between sections of the brain to provide a little more structure, stability, and shelving, if you will, to help support the brain. So we can see along this midline, front to back, is going to be what's known as the superior sagittal sinus. So what that means, you're not really seeing it from here. I'm just pointing out where that will be located. So the superior sagittal sinus is actually this portion here. We can see where the two portions of the dura mater, this line here just below the bone but above the brain, and see how there's a section that invaginates and goes down between the two hemispheres of the brain. So this is the superior sagittal sinus, and it's going to run anterior to posterior. This right side is if somebody has an epidural hematoma, meaning above the dura. This person, you can see here, has a fracture in the skull. That's the most common way to get it. So it's actually blood accumulating outside of the dura, between the dura and the bone. So here, the dural septa, these are the divisions, they are going to divide down, and we can actually see it would go down, say about here, and help kind of keep the brain from sloshing too much right or left. But we also see it comes down, and on the posterior side that we're looking at here, there's also a shelf laterally that separates the cerebrum from the cerebellum. So this here is another way that it helps hold the brain, kind of tether it in place. So this is our falx cerebri. That's going to separate the two halves of the brain hemispheres. We're just seeing a portion of it here in this image. Then we have tentorium cerebelli. So that means sort of think of it as a tent over the cerebellum. Then falx cerebelli, that's going to divide. So again, we have the falx cerebri dividing the cerebrum, and the falx cerebelli dividing the two hemispheres of the cerebellum. And then this diaphragma cellae. So here are some more beautiful pictures where we're seeing the dura mater peeled back. We see the arachnoid that's actually still intact. And this is part of the dura mater that actually is opened up. It's that sagittal sinus. So there would be blood inside of this region. Just to show you down in the spinal cord, this is what arachnoid mater looks like around the spinal cord, and this is the dura in this region as well. So the dural venous sinuses, that is recombining the cerebral spinal fluid back into venous blood from the brain, and are ultimately going to return via the internal jugular artery. So we can see on the right imaging where the dural venous sinuses are highlighted. We can see this really a nice sagittal sinus, superior sagittal sinus. This here, the left side is going to be anterior, the right side is posterior. This is a view from the posterior side as if we're looking at the back of the head, similar to this view here. So we see that in this case, the superior sagittal sinus comes down, and then we see it moving laterally, but oh my goodness, we're not seeing anything on this side. So in this case, this person has a blockage of his transverse sinus on the right side. This is a zoomed in view of what the superior sagittal sinus looks like, with the pink sections being those granulated arachnoid villi that's going to help return that cerebral spinal fluid that's running in this pink network. So let's talk about bridging veins. So let's go back here. So the bridging veins, see these veins here? That is also part of what's bringing blood back into, from the brain itself, blood back into this superior sagittal sinus. I'm going to show you a sequence. This is a brain with the dura mater on top of it. And then I'm going to peel back and lift this dura up. So we're now seeing the side of the brain. And I'm lifting up even more. And I can't lift it anymore because these little tethering points are the bridging veins. So the bridging veins, you can see a lot more obvious here. And the bridging veins are actually what would create a subdural hematoma. If these tore, you would have a bunch of blood accumulating under the dura. This is another beautiful view. This one was they were injected with latex, so you can actually see the blue venous structures and then the red arterial structures. This is a normal would look like on the left, and if a bridging vein were to rupture, if someone were to have their brain moving significantly side to side or front to back, you would see these veins rupture, and then you'd have accumulation of blood, and that would be a subdural hematoma. Here's an example that shows you an epidural hematoma in red, where you have a fracture of the bone itself, and now blood's accumulating outside of or superficial to the dura. Then this is a subdural hematoma. This is often due to the bridging veins being torn, and that is under the dura itself. So let's name the dural venous sinuses. Here's a list of the sinuses. We're going to identify these sphenoparietal sinus, then the cavernous sinus, moving into the petrosquamous sinus, coming laterally, bringing blood centrally. Then the superior petrosal as well as the inferior petrosal sinuses are located here. And then the straight sinus. And then these move out to the transverse sinus. The transverse sinus will ultimately become the sigmoid sinus. So the transverse sinus is only when it's going side to side on the posterior aspect. Now we can't appreciate it here, but the sigmoid sinus comes anterior, and then at this point where the word sigmoid is, it's actually descending, moving inferiorly, ultimately to get to the internal jugular vein. This posterior region is known as the confluence of sinuses, because not only do you have the straight sinus coming in here, you have the transverse sinus, and we don't see in this view, but you have that superior sagittal sinus also coming into this region. Now let's label the sinuses. So on this view, we're looking at someone's back of their head. So if you're looking straight behind, this would be the confluence of sinuses. Their head is actually turned slightly to the left, and it's as if you were standing behind them. Here we can label it. Now we can see the head is rotated to the right. So we have the back of the head, and we have the anterior part of the head. You can see the superior sagittal sinus. It comes down. This is the confluence of sinuses where they're all together. We see the straight sinus coming straight back, transverse going out to the side. We see the sigmoid makes this little squiggle, and then it goes down into the internal jugular vein. This right image, more easily see bridging veins as well as this cavernous sinus region. Finally, I want to show you the imaging for the transverse sinus obstruction. So here we can see an obstruction of this person's transverse sinus. So they get a stent placed in there to prop it open, and then this is what it looks like after surgery.